Over 60 and dealing with burning feet, numb toes, electric shock sensations, tingling, or balance problems. These aren't just strange or unavoidable signs of getting older. They arise from a biological environment in your body that has slowly shifted over many years. Most people hear that peripheral neuropathy means nerves simply wear out with age, like an old machine gradually failing. Some are told it's genetic and little can be done. The message, stated or implied, is usually to manage the pain and brace for steady worsening. What often goes unexplained is that nerves don't deteriorate randomly. They respond to the chemical conditions, blood supply, and daily metabolic signals around them. When that environment turns harmful, nerves struggle. When it improves, nerves can frequently hold on to more function than expected. Peripheral neuropathy isn't one single disease. It's a pattern of nerve damage. It describes what happens when peripheral nerves, the long pathways linking the brain and spinal cord to the rest of the body, start malfunctioning. These nerves handle signals for sensation, movement, balance, temperature, and pain. Because they are long and energy intensive, they are especially vulnerable to problems like unstable blood sugar, poor circulation, inflammation, and nutrient shortages. That's why symptoms usually appear first in the feet and hands, the farthest points from the heart, most dependent on tiny blood vessels. A key point is that nerve damage builds silently for a long time before symptoms show. For years, sometimes decades, nerves endure ongoing but invisible metabolic stress without clear warnings. In this quiet phase, damage advances. Proteins and nerve fibers distort, blood vessels stiffen, the protective coating thins, and electrical signals slow or lose precision. The nervous system compensates for a while, hiding early issues. By the time burning, numbness, or unsteadiness appears, the damage is already substantial. This delay explains why neuropathy often feels sudden and unfair, even though it developed gradually. In many cases, a major culprit is a group of compounds called advanced glycation end products, or AGEs. These form when glucose permanently binds to proteins and fats in the body. The binding isn't harmless. It alters the structure and function of those tissues. Once formed, AGEs are hard to clear and accumulate over time. They particularly target tissues needing flexibility, precise signaling, and strong microcirculation, making peripheral nerves a prime victim. To grasp why AGEs matter so much, consider the process at a molecular level. Glucose is essential fuel, but it's chemically reactive too. When blood sugar stays elevated for long periods, glucose interacts with proteins more often. In certain conditions, this creates permanent, rigid, sticky crosslinks. It's similar to sugar caramelizing and hardening when heated. In the body, it happens slowly and steadily when glucose control is poor. The result is tissue that's less elastic, less functional, and more inflammation prone. In peripheral nerves, AGEs hit three main areas at once. First, they alter the nerve fibers themselves, disrupting proteins vital for electrical impulse transmission. Second, they damage the myelin sheath, the fatty insulating layer that enables fast, reliable signal travel. Damaged myelin slows, weakens, or distorts signals. Third, AGEs injure the small blood vessels supplying oxygen and nutrients to nerves. These tiny capillaries are crucial for nerve survival. When they stiffen or narrow, nerves become undernourished and weakened. This triple effect explains the range of symptoms: burning pain from irritated, overactive fibers, numbness from lost signals, tingling from irregular firing, weakness from impaired muscle commands, and balance issues from unreliable sensory feedback to the brain. Symptoms vary in combination and severity, but the underlying pattern is often consistent. A frequently overlooked detail is that fasting blood sugar gives only a partial view. Many with neuropathy are told their glucose is normal because fasting levels fit standard ranges. But fasting shows just the daily low point, not the damaging peaks. The greatest risk for age formation comes after meals, when blood sugar rises and lingers for hours. These repeated post-meal spikes drive nerve damage over time. As we age, the body becomes less efficient at clearing glucose from the blood. Muscle mass declines, insulin sensitivity drops, and sugar stays elevated longer after eating. This doesn't mean aging directly causes neuropathy. It means aging reduces metabolic resilience. When combined with common modern habits, frequent snacking, late-night eating, and processed foods, it sets the stage for age accumulation. Vitamin B12 plays another vital role. It supports myelin maintenance, helps DNA synthesis in nerve cells, and clears harmful byproducts. B12 absorption often declines with age and is worsened by medications like acid blockers and metformin. Low B12 removes a key protective layer for nerves, allowing damage to progress instead of being repaired. Standard blood tests can miss functional B12 deficiency. Levels may look normal, but still fall short of what nerves need. This gap leaves many vulnerable without realizing it. By the time symptoms emerge, the deficiency may have lasted years. Dietary ages are another often ignored factor. Ages form inside the body, but they also come from food. High-heat cooking methods, grilling, frying, roasting, browning, produce large amounts of preformed ages. These are absorbed and add to the body's total load. Even with good blood sugar control, certain cooking practices speed tissue damage. Switching to gentler, lower heat methods can greatly reduce this intake. Once damage starts, inflammation amplifies it. Ages trigger immune responses that sustain nerve irritation. This explains why symptoms often worsen at night, when circulation slows and inflammation lingers. It also shows how neuropathy disrupts sleep, creating a vicious cycle. Poor sleep increases insulin resistance, stress hormones, and later sugar spikes, generating more ages and inflammation, which further harms sleep. Physical movement is one of the most effective ways to break this cycle. Muscles pull glucose from the blood after meals. Even brief walks can substantially lower post-meal sugar levels. This isn't mainly about weight loss or intense exercise, it's about better metabolic regulation. Consistent activity reduces the raw material for ages and improves nerve blood flow. Muscle strength matters too. Muscle loss impairs glucose uptake. Light resistance exercises preserve muscle, support metabolism, and indirectly protect nerves. This benefit is often undervalued because it develops gradually, not immediately. Hydration supports circulation and clears metabolic waste. Dehydration thickens blood, reduces microvessel flow, and concentrates glucose. Many older adults drink less without noticing, subtly raising nerve risk. Consistent fluid intake bolsters vessel health with minimal effort. Stress affects neuropathy through hormones. Chronic stress raises cortisol, which increases blood sugar and promotes insulin resistance. Stress alone doesn't cause neuropathy, but it worsens the metabolic conditions that damage nerves. Simple stress reduction techniques ease this burden and improve stability. One of the most harmful misconceptions about neuropathy is that progression is inevitable. This belief discourages action and leads to passive acceptance of decline. While severely damaged nerves may not fully recover, many partially affected ones can stabilize and function better in a supportive environment. People often report reduced pain, improved balance, better sleep, and higher quality of life once new damage slows or stops. The goal isn't perfection, it's protection. Every period of stable blood sugar is time free from chemical assault on nerves. Each better night of sleep supports repair. Each reduction in inflammation aids signaling. Over time, these small improvements accumulate, just as the earlier losses did. Peripheral neuropathy isn't merely a nerve disorder. It's a metabolic condition that shows up earliest in nerves. Viewing it this way transforms it from an unavoidable destiny to something you can influence. The focus shifts from symptom management alone to stabilizing underlying causes. This offers no guarantee of miracles, but something more reliable, meaningful influence over the process, and that influence matters a great deal. When people realize peripheral neuropathy stems from prolonged metabolic stress rather than sudden nerve failure, another insight often follows. The nervous system doesn't work in isolation. It constantly interacts with other body systems. Blood vessels, muscles, hormones, immunity, and the gut all influence whether nerves stay resilient or deteriorate. This interconnectedness explains why neuropathy rarely appears alone. It typically comes with fatigue, sleep issues, digestive changes, balance difficulties, or mild brain fog. These aren't unrelated. They're different expressions of the same core imbalance. A commonly overlooked contributor is persistently elevated blood sugar after meals that doesn't qualify as diabetes. Many spend years in this gray zone where glucose surges high and lingers after eating, yet standard tests read normal. During this period, ages build silently. Without a formal diagnosis, people assume nothing serious is being missed, but neuropathy doesn't require a label. It responds to continuous exposure. Nerves react to their chemical surroundings, not diagnostic thresholds. Glucose clearance depends heavily on muscle tissue. After meals, insulin signals muscles to absorb and store sugar. When muscle mass declines, this process weakens. Glucose lingers longer in the blood, prolonging glycation. This helps explain why neuropathy risk increases with age, even without weight gain. Even lean, seemingly healthy individuals may have lost substantial muscle, especially without strength training. This muscle-glucose connection also highlights why activity provides strong nerve protection, even without major diet changes. Regular short walks after meals reduce spike height and duration. Over months and years, this leads to fewer ages, lower inflammation, and better circulation. The benefit starts modestly, but grows substantial. It targets the cause more directly than symptom-focused approaches. The vascular system is central too. Nerves rely on a delicate network of small vessels highly susceptible to glycation and oxidative damage. Ages stiffen vessel walls, reduce nitric oxide, and impair needed dilation. This causes chronic mild underoxygenation, especially in distant nerves. Feet are affected first not because they're inherently fragile, but because they're farthest from the primary blood supply. This vascular aspect explains why symptoms often worsen in cold weather or at night, when flow naturally decreases. It also accounts for why past smoking raises risk. Vascular damage persists and compounds metabolic injury. Inflammation runs through the entire process. Ages activate receptors that trigger inflammatory cascades. These increase oxidative stress, impair nerve cell energy production, and worsen insulin resistance. Inflammation both results from damage and fuels more of it. This cycle explains why neuropathy can accelerate after symptoms begin, even without lifestyle changes. Sleep serves as a critical repair period. During deep sleep, inflammation decreases, insulin sensitivity improves, and growth factors support maintenance. Neuropathy that disrupts sleep shortens this recovery window. Over time, poor sleep undermines metabolic control and hastens nerve damage. This bidirectional relationship means even modest sleep improvements can yield significant benefits. Eating late at night is particularly harmful here. Food close to bedtime elevates sugar when insulin sensitivity is already lower. This prolongs hyperglycemia and interferes with overnight repair. Shifting the final meal earlier often improves sleep quickly and gradually eases neuropathy symptoms. No new foods or medications required, just timing aligned with natural body rhythms. Gut health also influences nerves. The gut manages nutrient absorption, immune regulation, and inflammation control. Poor digestion or chronic gut irritation can reduce uptake of B vitamins, magnesium, and other essentials. It can also drive systemic inflammation. Gut issues rarely cause neuropathy alone, but they heighten risk and slow recovery. Supporting gut function improves the overall nerve environment. Emotional factors deserve attention too. Persistent pain, worry, and fear of progression can trigger anxiety or depression. These disrupt sleep, elevate stress hormones, and reduce motivation for self-care. This creates another cycle, psychological yet profoundly physical. Breaking it requires compassion, support, and realistic expectations, not self-criticism. Not all neuropathy is metabolic. Autoimmune conditions, infections, toxins, chemotherapy, and genetic factors can damage nerves as well. Nevertheless, metabolic health influences severity and progression in those cases too. Stabilizing blood sugar, reducing inflammation, and supporting circulation benefit nerves regardless of the initial trigger. This makes metabolic strategies foundational. When people make adjustments to stabilize their metabolic environment, improvements often arrive quietly. Pain lessens somewhat, sleep improves, balance feels more reliable. Temperature sensation may partially return. These changes can go unnoticed if dramatic reversals are expected, but they are meaningful. They indicate slowed damage and better performance in surviving nerves. Track progress over weeks and months, not days. Nerve recovery is gradual. Metabolic shifts take time. Fluctuations are normal. A difficult day doesn't undo progress. Focusing on longer-term trends provides the accurate view and prevents discouragement. In advanced neuropathy, the primary aim is preserving remaining function. Halting further loss dramatically enhances daily life. Reduced pain, better sleep, and greater stability promote independence. These improvements matter greatly, even without complete sensation restoration. Medical care remains essential. Sudden or rapidly worsening symptoms warrant evaluation to exclude other causes. Don't discontinue symptom medications without guidance. Lifestyle measures complement, not replace, professional treatment. Research increasingly views neuropathy differently. What was once considered inevitable aging is now seen as modifiable, shaped by lifestyle, metabolism, and overall health. Complete reversal isn't possible for everyone, but many have greater influence over their course than previously believed. The most important shift is perspective. Neuropathy doesn't simply happen, it develops within a specific internal environment. Alter that environment, and you alter the outcome, not quickly or completely, but meaningfully. Effective long-term management of peripheral neuropathy depends more on consistent small habits than dramatic interventions. Nerves respond to repeated patterns, not occasional perfection. One strong week followed by a prolonged lapse achieves little, but modest positive steps sustained over years can redirect the trajectory of decline. It may feel gradual in a world seeking quick solutions, but it aligns with how nerves actually adapt. Aging introduces natural changes that increase neuropathy likelihood. Insulin sensitivity declines, cellular energy efficiency drops, and low-grade inflammation rises. These occur even in those maintaining good weight and appearance. The changes are slow and easy to miss until symptoms appear. Recognizing this reframes neuropathy as the gradual accumulation of small shifts over decades. Aging also weakens nerve-muscle connections. Motor nerves gradually withdraw from muscle fibers, leaving some under-innervated. Surviving nerves attempt compensation, but there are limits. Over time, movement precision decreases, balance declines, and nerve muscle signaling weakens. This elevates fall risk and reduces activity, accelerating muscle loss and metabolic issues. Foot care grows increasingly vital as neuropathy progresses. Reduced sensation heightens the risk of unnoticed injuries, ulcers, or infections. Daily foot inspections become an essential routine. Proper footwear, skin moisturizing, and monitoring calluses or nail changes help prevent major complications. Many severe neuropathy problems arise not solely from nerve damage, but from avoidable foot issues that go undetected. Chronic pain alters brain processing. Sensory, emotional, and attention regions become hypersensitive. This central sensitization amplifies pain and lowers tolerance. Neuropathy management therefore includes calming the central nervous system. Techniques such as slow breathing, mindfulness, or gentle activity can reduce symptom intensity despite ongoing peripheral damage. Pay attention to key nutrients that support nerves. B12 deficiency can mimic or exacerbate symptoms. Magnesium assists nerve signaling and relaxation. Supplements should involve testing and medical oversight, but identifying reversible deficiencies is worthwhile. Hydration influences blood viscosity and flow. Mild chronic dehydration restricts microcirculation and reduces nerve oxygenation. Thirst perception often diminishes with age, increasing vulnerability. Consistent adequate fluids strengthen circulation. Social connections provide unexpected advantages. Loneliness elevates stress, impairs sleep, and reduces self-care motivation. Maintaining relationships with family, friends, or groups supports emotional well-being and indirectly improves physical outcomes. Activity often feels easier and more consistent with others, adding metabolic benefits. Fear of deterioration can subtly restrict choices. Some avoid movement to prevent pain or falls, but this accelerates decline. Replace fear with informed action. Adapted exercise is safer than inactivity. Nerves benefit from gentle use. Inactivity signals the body that the area is less essential, reducing repair priority. Regular medical appointments for chronic conditions can feel rushed. Arriving with clear notes on symptoms, changes, and questions improves discussions. Advocating for yourself enhances care. It's not confrontation. It's necessary for effective ongoing management. Caregivers need support as well. Witnessing a loved one's persistent discomfort is challenging. Understanding that progress is uneven and ups downs are normal helps set realistic expectations. Supporting caregivers ultimately benefits the person with neuropathy. Over time, the impact of small constructive choices becomes evident. Those who prioritize metabolic stability, movement, sleep, and emotional health often experience slower progression and fewer complications. Symptoms may persist, but they become more manageable. Life remains active and meaningful rather than restricted. The most powerful concept is this: neuropathy is a condition, not your identity. You are a person with history, relationships, abilities, and aspirations. Holding this perspective prevents the condition from dominating life more than necessary. B vitamin status deserves early focus. Routine monitoring of B12, folate, and B6, particularly after age 50 or with medications like metformin or acid suppressors, can detect deficiencies before nerve health suffers. Early correction, via diet, sublingual forms, or injections when appropriate, reinforces myelin preservation and repair that bolster nerve resilience. Hydration, sleep, and stress management form key preventive foundations. Sufficient daily water keeps blood thin and microcirculation effective. Consistent quality sleep safeguards the nightly repair phase when inflammation decreases and insulin sensitivity improves. Simple stress reduction practices, deep breathing, short walks, time in nature, prevent sustained cortisol increases that drive glucose elevation and insulin resistance. For families, prevention benefits everyone. Many nerve protective habits also lower risks for heart disease, cognitive decline, type 2 diabetes, and other age-related issues. When older family members model earlier meals, regular movement, gentler cooking, and nutrient awareness, younger generations adopt them naturally. Children and grandchildren learn that metabolic health is built daily, not lost later. Conversations about neuropathy can move from frightening warnings, "Don't let this happen," to practical, encouraging guidance. "Here's what I wish I'd started earlier." Sharing simple adjustments, like family walks after dinner or milder cooking methods, makes prevention feel approachable, not intimidating. Screening is important too. Regular monitoring of fasting glucose, HbA1c, and, if feasible, post-meal patterns can identify early metabolic shifts. Even within normal ranges, gradual increases over years can prompt small interventions before permanent damage occurs. Inquiring about B12 and other nerve-supportive nutrients during checkups is another straightforward preventive step. One of the strongest preventive mindsets is curiosity rather than resignation. Instead of assuming nerves just fail with age, those who remain curious about how daily choices affect the body make more protective decisions. They notice how specific foods, late eating, or habits influence energy, sleep, or subtle foot sensations. That awareness drives incremental improvements long before symptoms demand attention. Prevention isn't flawless execution or zero decline. It's accumulating small protective factors year after year so the downward slope flattens considerably. Someone in their 70s or 80s with only mild, occasional tingling, solid balance, and reasonable sensation has typically followed these principles quietly for decades. Not extremes, but steady habits. The information here isn't hidden or overly complex. It draws from decades of research on metabolism, glycation, inflammation, nerve function, and aging. What's often lacking is a clear, practical explanation of how these elements connect, especially for those over 60 experiencing symptoms or supporting loved ones. Peripheral neuropathy doesn't have to be a mysterious or unstoppable verdict. It's a signal, a delayed alert that the internal environment has drifted too far from balance for too long. The encouraging reality is that the same environment permitting damage can usually be gently guided back toward conditions that slow, stabilize, or partially restore function. You don't need to undo decades of change overnight. You simply need to stop contributing to the problem now and continue that tomorrow and beyond. Each hour of balanced blood sugar, each gentle walk, each improved night of sleep, each reduction in inflammation is a small vote for nerve preservation. Over months and years, those votes accumulate. They don't erase all damage, but they rewrite the narrative, from inevitable worsening to managed stability, from resignation to genuine hope, from helplessness to real agency. That shift from nothing can be done to I can influence a great deal is where meaningful change starts.